Good afternoon and welcome to Nasdaq Trade Talks. I'm your host Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me at the MarketSite in Times Square, we have Robert Garrett. He's the CEO of Hackensack Meridian. We're going to talk about some hot topics coming up in healthcare going into Davos. Thank you so much for joining us at MarketSite. Hackensack, right over the river where I am.
River.
Too, so
thanks for having me, Jill.
It's great having someone from New Jersey with us. Let's talk about that. The hot topics at the World Economic Forum in Davos, I would imagine data is going to come up in there somewhere.
Oh, data is definitely going to come up in there, you know, especially with the health electronic record now and the sharing of data and trying to balance. I think one of the topics we're going to talk about is balancing that sharing with protecting privacy. And that's, you know, a huge issue, particularly with some of the European countries. They're really, you know, they have some pretty significant privacy rules and regulations out there. But there's just so much that can be learned by the sharing of data. You know, you can really prevent disease by sharing data. You know, certainly curing diseases by sharing research data, and it leads to better treatments. So we got to find that right balance. That's going to definitely be one of the topics.
Are you going to talk about the shift in industry business models?
We are. We're going to talk about the shift in industry business models. Certainly the shift toward value-based care. There's going to be a focus on health prevention and population health. That's really going to be so important because we need, if you think about it, we need to retrain physicians. We need to retrain our workforce to really focus in on prevention. And if we're really going to bend that cost curve, we really have to get at those social determinants of health and really focus in on population health. So we spoke pre-Davos amongst the healthcare leaders that are going to be attending, and we said we'd really like to focus on those types of topics. And there's just so much there to talk about, but I think that's going to be a major focus.
How is the future of healthcare delivery systems going to change? I mean, there's a lot of people on this planet that are aging 60 and over.
Oh yeah, I mean it's really staggering. So again, I think we're going to need to focus on prevention. We're going to need to focus also on research and discovery, Jill, because it's important that some of the research that's going on now can translate into cures, into helping people manage chronic diseases. One of the areas that I think we'll be talking about is regenerative medicine, because there's so much going on in cellular therapy that can potentially slow down or even reverse the progression of chronic diseases like diabetes, heart disease, cancer, and of course the aging process itself. So there's a lot there, and we're really on the verge of really taking that research and putting it into practice. So I think what we need as a healthcare community is to say, okay, what are our strategies for making that happen soon, because the population, as you just said, is aging.
What about the challenge of education, though? We could talk about this all day long, and if you do preventative medicine, it's going to be less costly to you from an insurance perspective, from out-of-pocket perspective. You can lead a horse to water so much, but where's the challenge with education?
So the challenge in education, I think, starts with medical education and academics. So as an example, at Hackensack Meridian, we just opened up a new medical school, and the focus there is on population health, on prevention. We actually immerse our medical students into the community. They adopt families during their medical education for 3 years of their 4-year program. And that really helps them focus on the importance of prevention, population health. The other piece with education and academics I think is important is for the teams to start working together. Interprofessional academics really important. Let's take away those silos that exist between, medical students, nursing students, allied health students. Study after study shows when they actually work as a team, results improve significantly. So those would be 2 areas that I'd like to bring up based on our experience at the Hackensack Meridian School of Medicine.
I think it's really interesting that you team up the interns for 3 years with families. It humanizes it so it's not so clinical.
Absolutely.
And I think that's key.
And they focus on those social determinants too. They go to underserved areas. They look at food insecurities, other types of challenges, adhering to medication regimens, that type of thing. And they really can understand the entire family environment, and it makes them a better doctor, I believe.
What do you think the future is for healthcare? I mean, could it get better? It's such a national hot topic for us, and there's a lot of work to do. I mean, can it be done? I think the future is going to be about partnerships and collaboration. That's the only way we're going to really make it better, whether it's government and private sector or within the healthcare community, actual collaborations. So we just announced today, as a matter of fact, a new collaboration in the behavioral health area between the Carrier Clinic and Hackensack Meridian Health. Those are the types of partnerships I think that are really going to frame the future of healthcare, not just in the U.S., but across the globe. All right, well, thank you so much for joining us. Looking forward to seeing the content that comes out of Davos.
Absolutely. Thank you, Jill.
And thank you for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.